So my understanding is you've been doing hair restoration for quite some time and the technology's improved. What can you tell me about your techniques these days?
Well, you know, I've been doing it since 1999, and I started using the strip technique, which is an excellent technique, but at this point I've transitioned over to using smart graft technology, which is automated follicular unit extraction. And there are many advantages. One of it with follicular unit extractions, it means we're taking out the follicle in smaller amounts of hair, and we're able to take it out more precisely with this automated technology, the smart graft, and then also we're able to implant it more precisely and give a more natural look. The hair is extremely important, as everyone knows, throughout history. It really frames your face. It's what people see. And having a full head of hair also just communicates robustness and youthfulness. So it's important to many people. And so I get great joy from doing hair restoration, particularly using smart graft. Again, because there's no linear scar, people can wear their hair short. There's usually faster recovery time with it, and just more natural results, which is what we want. So it's just a great procedure.
It sounds like there is a process with it. How long does it take to, or does it depend on what state you're coming in at?
It does depend on how many grafts. We go by grafts on how many you actually need. But most hair transplants using the smart graft or otherwise, it's going to take most of a day because we have to remove the hair and then we have to implant it. But we do it in a very humane way. The patients, we make them very comfortable. It's done with oral sedation. Patients are awake, but we feed them lunch because they're here most of the day. I have a TV where patients can watch TV while we're doing the procedure, or they can actually even work on their iPad for part of the procedure if they have it, if they want to, or they can just relax and do nothing.
So is there pain involved?
Well, I do it with oral sedation. I do have to numb up the patient, but I do it with tumescent anesthesia, so it's a little less painful. But after the patient's numb, there's no pain.
And then is there a long recovery time?
You know, generally not. People, especially with smart graft, they're able to go back to work in a couple of days. The biggest issue with smart graft or with any hair transplant is you have to be extraordinarily careful where we implant the new hairs. You can't, generally I don't allow my patients to touch the areas for about 2 weeks. So because it can come out, and you've made such a great investment in this, and it's so important that you have to be, I'm very fastidious and very firm about not touching your hair for 2 weeks. After that is fine.
So is the idea that you're putting the follicles in areas where they wouldn't normally grow and it's supposed to take root? Is it your own hair?
It's your own hair.
Okay.
So the hair back here and along your temples, it's not affected by this particular type of testosterone, which your hair is up here, and which is why you lose it, especially if you have a genetic predisposition to that. But it's interesting that the hair that we take from here, and then if we implant it or transplant it here, it will not fall out. It's not going to be affected by that testosterone. So it's permanent, which is amazing because how many cosmetic procedures are permanent? Not. Even facelifts I do may last 10 years, but that's about it. So this is a great investment for the rest of your life, and that's why it's a very satisfying procedure. So the hair stays in here, and then we do it in a certain random way with the smart graft that, again, people, you can wear your hair very short and people won't know that you had a hair transplant.
Sounds like a miracle. So is it available for women as well?
Women tend to have more diffuse hair loss. So it tends to be more challenging. It's easier to implant hair into a bald spot. Women tend to have more what we call frontal diffuse hair loss. But yes, it can be performed in women and successfully too. It doesn't have quite the results, or at least in my hands, it's not quite as successful as in men because of that, but it definitely can be rewarding and can be worth it for many women.
So if you have long hair, will it eventually grow out to whatever length you want it to be?
Yes, but it takes a while. We actually cut the hair short for a variety of reasons when we're implanting it, and so it can take up to a year. It does grow, but it can take easily up to a year.
And then past the year, then it's like normal?
Normal.
Wow.
Yeah, it's normal length, but it'll take up to a year, and it's just normal.
Sounds like a really exciting option for people who otherwise would have zero options and just have to live with whatever their hormones or their DNA.
Yeah, or there are other options, but they're just they're still not as good as the hair transplant. Maybe something in the future will come out that's better, but still this is the most permanent way of doing it, and once it's done and successful, you have it for the rest of your life.
Yeah, having it be permanent seems like you said, it's so rewarding.
Yes.
So is it very expensive?
It is. Well, everything is relative, but with the smart graft, it's a little more expensive than the older strip technique. Generally, hair transplants at the Gladstone Clinic probably are going to range between $12,000 and $25,000.
But the fact that it's permanent is practically priceless.
Right. Well, I try to explain. It's hard because it's not cheap. But if you look at it as for the rest of your life, an investment for the rest of your life, and it's going to make in many patients a dramatic difference, then it is worth it. So,
and
yes.
do you work with them on payment programs and things like that?
We have a variety. We have actually a number of financing plans, and actually one that's specifically for hair transplants. So, yes.
Is there anything more about that procedure you want to share?
Well, hair transplants can be rewarding. You want, if you're a candidate, the best candidates are candidates that have a good donor site until we clone hair. You need a good donor site, and then also stable hair loss. If you're still having a lot of hair loss, then you'll probably want to wait until it's much more stable before you come in for a consult for hair transplant. But if anyone has a question, we offer complimentary consultations, and I'm happy to give my opinion.
And a donor hair site is basically just enough hair growing in a certain spot that you can pull from?
The donor area is back here, back of the head, and then also along the temples. So there has to be enough there.